Okay, ladies and gentlemen, welcome. Welcome to the session on updates and lessons learned on WaSH in schools and safe school reopening during COVID-19. Organized by the WINS network, a global interagency network of WaSH in schools, with the aim to harmonize efforts and support governments working to improve WINS services and also to promote exchange of experience between countries. My name is Herwig Langthaler, and I have the pleasure to guide you through this next hour, which will be mainly about latest data and interesting examples from different countries. On behalf of the organizers, I would like to, at this point, to acknowledge the generous support of the sponsors of our session, German Corporation, GSZ, and the WINS network. We are happy that so many participants now from different countries are interested in this topic and joining the session. So I'm at the beginning inviting everybody to write now his or her name in the chat, in the Pathable, and also to add the country where you are working, so that all of us have an impression about who the audience today is. And later you will be invited to post some questions in the chat directly to the speakers, and they will then try to answer them at the end of the session. Meanwhile, I would like to present to you the agenda of the session. May I ask for the agenda slide? Thank you very much. So we have introductory remarks by Dr. Bella Monse. We will have a presentation by Dr. Christy Chatterley to provide the global perspective and a kind of bird view on latest evidence and progress made in terms of safe school reopening. And this will then be followed by a presentation from Ecuador, giving an example of a promising process and respective tools implemented towards safe school reopening. And after that, we will have 3 pre-recorded presentations from Southeast Asia, each of them zooming in school readiness assessment, implementation in Indonesia, bringing capacity building to scale with massive open online courses in the Philippines, and also an app to calculate WaSH operations and maintenance costs. More information on these products can be found on the website of the WINS network. You will find that also in the link in the chat. Okay, but now let me introduce, please, to you for her opening remarks, Bella Monse. Bella is a senior advisor at GSZ, working on the topic of WaSH in schools and school health promotion since more than 20 years in Asia. In the last 10 years, she has been involved in WINS global networking activities, and she's a core group member of the WINS network. Bella, may I ask you to come to the virtual stage? We are looking forward to your opening.
Okay, can you hear me? Am I at the virtual stage now?
Yes, very good.
Thanks a lot. Yeah, dear colleagues and dear partners, and thanks, Herwig, for your welcoming words. In behalf of the WINS network, I'm welcoming you to this event at the UNC Conference Water and Health. The WINS network, as Herwig already said, is an informal interagency network, specifically to foster alignment and harmonization of strategies between development partners and NGOs in order to support Ministries of Education and other government agencies to improve water, sanitation, hygiene in schools around the globe. The network is guided by the SDGs that by the year 2030, all schools around the globe have access to drinking water, basic sanitation, and basic hygiene services. Please visit the link to the website in the chat box. As we all know, the COVID pandemic has caused huge challenges in everyone's life, and specifically in the life of children. So schools around the globe have been closed, and in some countries, the schools have still not opened their doors until today. To address the pandemic, guiding bodies like WHO, UNICEF, and UNESCO have developed global guidelines and recommendations to support Ministries of Education and Ministries of Health to develop country-specific guidelines for safe reopening of schools. But schools around the globe are very, very challenged to comply with these specific guidelines. And the condition of WaSH in schools is key for safe reopening and safe operation of schools, also outside pandemic times. The WINS network supports exchange between Ministries of Education and other players in the education landscape and fosters learning from each other's experience. And this is also what the entire event today is about. So during these most challenging times, alignment of development partners and collaboration is key to successfully support the ministries to open schools and manage them safely. And in line with this, the WINS network supports the Mission Recovery Education 2021, spearheaded by UNESCO, UNICEF, and the World Bank. Please, colleagues, open your ears and minds to the shortened video of the WINS, and take this mission forward in your professional and living environment. Thanks, and have a good event.
As we know, the COVID-19 pandemic has disrupted education around the world at a scale never seen before. According to UNESCO, close to 700 million students are still affected by full or partial school closures. While many countries have reopened schools for at least partial in-person instruction, COVID-19 continues to cause recurring closures and lockdowns. Getting all children back into schools is just the beginning of the steps to recovery. From our joint service, we know much more support is needed to address the impact of school closures on students' learning, health, and well-being.
COVID-19 has affected many students globally, but the most vulnerable children and youth have borne the brunt of school closures. Not only have they been cut off from learning, they've been separated from peer and teacher support and critical services such as psychosocial support, nutrition services often offered at school. They may also have been exposed to violence, neglect, or exploitation. These children are depending on us to get these critical next steps right. Schools must reopen, and the full range of support services must be offered to students when they walk through those doors, including remedial and catch-up learning. Otherwise, as many of you have seen in different countries, the most vulnerable children will never recover from this education crisis and may not return to their learning at all. This is why we have launched our joint mission, Recovering Education 2021. To teachers and parents around the world, we thank you all for your efforts to support the continuity of learning throughout the pandemic and now during the recovery. We urge governments to keep working with us to implement this mission, and we will continue to do everything we can to help at this critical moment. Together, we can make the reopening and recovery in schools better for every child and ensure the most vulnerable are not left even further behind.
Okay, thank you very much, Bella, for the introduction, and thank you very much for showing that video. Well, we, as announced, are continuing now with hearing about the global perspective with the latest data regarding safe school reopening. I already see Christy on the video. It will be presented by her, Christy Chatterley. She has been working on monitoring and evaluation of WaSH in schools for the past 10 years. Today, she's assistant professor of engineering at Fort Lewis College in Colorado, USA, and she also consults for the WHO UNICEF Joint Monitoring Program, the GMP, responsible for global monitoring of WaSH. Christy, we are looking very much forward to your presentation. The floor is yours, please.
Thanks so much, and it's a pleasure to be here. Thank you to everyone for joining this session. I'm just going to give an update on global data on WaSH and school reopening. So on the next slide, the latest iteration of the survey on national education responses to COVID-19 school closures highlighted that the availability of resources to ensure safety, that includes soap, clean water, toilets, masks, it really varied by wealth. So in low-income countries, less than 10% of respondents said that they had sufficient resources to safely open, and then high-income countries had 96%. So a really big disparity between countries. And on the next slide, So it's really important for children to be able to go back to school. As Bella said, WaSH is a critical element of that. And different guidance documents for the safe reopening and operation highlight the importance of hand washing facilities that have water and soap, basic drinking water, and basic sanitation. And these services are critical to a quality education during the pandemic, but they were critical before, as Bella mentioned, they're going to be critical after. And for this reason, they were included in the Sustainable Development Goals, specifically Target 4A, which the next slide goes through in more detail, where you see, next slide, please, sorry, where you see the target or indicator definition. On the next slide, please. Sorry, my computer might be slow. Hopefully it's not on my end. So the indicator definition for Target 4A specifies 7 different services that are a part of the target. And the last 3 of them are basic drinking water, basic sanitation, and basic hand washing facilities. And there's a note in the SDG language that these are per the WaSH definitions. And on the slide, we have the definitions of those basic services. Let's see if we can get that up. Would it be easier if I share my slides? Would that help?
So I think there was a Fred coming in with the slides for a moment. I think they're working in the background. I propose you just continue, Christy, and
I can share mine if that works. I just opened up my screen. Can you see that?
Yeah, we can see it. Is it your screen now, Christy?
Yep, we'll just
Very
do
good.
that.
So then you have everything in your own hands now.
Perfect. That works great.
Okay.
Everyone. So here's Target 4A, really detailing the language from the SDGs. And these basic levels are defined in the table below. So for basic drinking water service, what that means is that schools have drinking water from an improved source, like a protected well, piped water, and water is actually available. Basic sanitation service is that there are improved sanitation facilities like a sewer, a toilet connected to a sewer, a pit latrine with a slab, and those facilities are single sex and they're usable, defined as available, functional, and private. And then basic hygiene is that there are hand washing facilities with water and soap available at the school. And the Joint Monitoring Program, or JMP, uses what we call service ladders to track progressive realization towards these services. So in yellow, you see a limited service where infrastructure is present, such as an improved drinking water facility or improved sanitation facilities, but all the criteria for basic service are not being met. Maybe water's not available or soap's not available. And then for no service, the infrastructure itself is missing. And so in JMP data, you'll tend to see these ladders where you have orange on the bottom for no service, limited in yellow, and then the basic service in one of these colors. So we released a 2020 report, and that included data from over 800 sources. And we produce these every 2 years. So our next one is coming up next year. So this is a really interesting opportunity to look at global coverage of WaSH in schools before the pandemic. The 2020 report highlights up to 2019. And then in this report coming out in 2 years, we'll be able to look at during the pandemic and see if there are changes. But for this latest report, which I'll go through a summary of in the next few slides, we had estimates for 173 countries, on average, almost 5 data sets per country. And these data are coming from education management information systems, from the Ministry of Education, from UNESCO Institute of Statistics, and from school surveys at the national level. So if we look at what came out of all of those data, we see that under 70% of schools had a basic drinking water service in 2019. So this means going into the COVID pandemic, almost 600 million children didn't have this basic drinking water service at their school. And if we look at the trend in coverage, we would need to improve or increase the rate of progress 7-fold to meet the SDGs by 2030. For sanitation, we had estimates for 117 countries, and globally, 63% of schools had this basic sanitation service in 2019. So nearly 700 million children did not have a basic sanitation service before COVID. And again, we're seeing really slow rates of progress. We need to improve this or increase it 5-fold to meet the SDGs. And then of particular importance during COVID and for disease prevention in general, we have estimates for 110 countries on basic hygiene and found that globally, 57% of schools had a basic hygiene service in 2019. And remember, a basic service is just a hand washing facility with water and soap available. So this left a lot of children without the ability to wash their hands before COVID. And this varies greatly by region. So there are some regions where there's really high coverage and other SDG regions such as Oceania and Sub-Saharan Africa, where coverage is really low. We're seeing a higher rate or a faster rate of improvement, but we still need to increase this 4-fold to meet the SDGs by 2030. And we see even greater variation in coverage when we look at individual countries. There's some countries that went into the pandemic with very few schools having hand washing facilities with water and soap available. And we see disparities when we look within countries as well. So for example, if we look at urban coverage versus rural, we tend to see that rural schools are less likely to have hand washing facilities and water and soap. And this gets even more challenging when we look at the different elements of WaSH. So if we look at the proportion of schools that have all 3 elements, water, sanitation, and hygiene at the same school, we see a very steep decrease in coverage. So for example, in Nicaragua, over half the schools had drinking water, 12% had basic sanitation, and 40% had basic hygiene, but only 1% of schools in the country had all 3 of those services. They're so important to limiting disease transmission, and particularly during COVID. If you want to learn more, there's interactive data available on the JMP website, washdata.org. You can click on data and then schools. And you can also download individual country files here and see the actual data points that go into the JMP estimates and any assumptions that were made. So just to wrap things up, school reopening is so critical, and children definitely need to go back to school. The benefits outweigh the risks that we know of currently, but COVID is really shining a spotlight on how critical WaSH is. And it was critical before, and it will be critical after COVID as well. So one question that will be interesting to look at when we start having new data is if the COVID response will actually increase the rate of progress so that all schools do meet the SDGs and they all have basic WaSH services by 2030. So for next steps for the JMP, we're compiling national data currently for the 2022 global update. So if you have national data on WaSH in schools, or if you have examples of how the COVID response is leading to improved WaSH in schools, which we'll see a great example of from Ecuador after this, please send those data or examples to info@washdata.org. Anything we receive before the end of October, we'll be sure to get in the next report. And after that, we'll try our best, but we'll definitely include it in the following report in 2024. Thank you so much for your time. And again, apologies for the technical difficulties.
Great, thank you very much, Christy. This was very, very comprehensive and informative in a very, very short time. I can imagine that there are already quite a few questions, so everybody is invited to post those questions in the chat in Pathable, and we will come back to that at the end of this session, having asking Christy to have a look at that. Thank you very much. We are continuing now with the first country example. Christy already mentioned, now from Ecuador, presented by Konrad van Grenest. Konrad is a WaSH specialist with UNICEF Ecuador. And during the COVID-19 sanitary emergency, he led the WaSH cluster, working closely with the Ministry of Education on WaSH in schools in Ecuador. Konrad, I already see the first slide. Please, the floor is yours.
Thank you very much, Herwig, for this introduction, and it's a pleasure to be in this event to share some lessons learned in the process, how WaSH in school supported the Ministry of Education to try to promote the return to schools as soon as possible. So I will share the example from Ecuador. Next slide, please. And just to give you an overview of the education community countrywide in Ecuador, we are talking about 16,000 schools in Ecuador, giving education to 4.4 million children through 220,000 teachers. So, and as of 15 March 2020, the start of the pandemic, all those 4.4 million children were out of schools. All schools were closed temporarily, and then while the pandemic was moving forward, we tried to see with the Ministry of Education what would be the necessary steps to go to a progressive reopening of the schools. So one of the first actions we took was conducting WaSH in Schools national assessment. After this, in July 2020, a hygiene protocol for progressive use of educational institutions was developed between the Ministry of Education and the Ministry of Public Health. On 14 September of 2020, the guidelines for progressive return to schools were published. And we also supported the Ministry of Education in October through an online course for teachers on WaSH in schools. Then in January, we did a costing exercise to cover the WaSH in schools gap. And then finally, after some pilot exercises, as of the 1st of June this year, so a few months ago, there was a specific decision to go to the return to school at scale in the country. So I will go in each of these steps a little bit more in detail. First, on the WaSH in Schools national assessment. This was a joint initiative between the Information Infrastructure and Risk Management Directions of the Ministry of Education with our support. So an online questionnaire was sent to all schools using the COBO toolbox. And this questionnaire was based on the core questions for monitoring WaSH in schools from the joint monitoring program. The ministry also developed a video tutorial to assure the quality of the information, and we had a 95% response rate. So almost all of the 60,000 schools responded within 10 days after launching the questionnaire. So, and as Christy presented as well, these service levels, we have this information. If we can go to the next slide, please, for each school countrywide on the level of service in the water, sanitation, and hygiene. So here you can see some maps on water, on hygiene, and on sanitation, and their service levels. And in the next slide, you can see some graphs also on water to the left, hygiene in the middle, and sanitation to the right, and the number of schools in each level on water, sanitation, and hygiene. Next slide, please. So on the hygiene protocol that was developed jointly between the Ministry of Education and the Ministry of Public Health, just to highlight a few key messages there. Of course, the protocol is more extensive and you can download it in the link below. On the protocol defines rules on the use of the mask, on hand hygiene, disinfection, and social distancing. And this is also monitored within the schools that are reopening. Next slide, please. On the online course for teachers, so basically the idea was to give access to the hygiene protocol, developing an online course, a massive course, which is available on the official Ministry of Education training platform for all teachers in the country. It consists of 5 training modules, focusing on the protocol, but also generally on water, sanitation, and hygiene in schools. And there have been 9 sessions that have been developed so far, where in total more than 14,000 teachers have completed the course so far. So it's quite a massive course, 14,000 participants, but knowing that there are 220,000 teachers in the country, there's still some way to go in the country. So the process to return to presential classes, to go back to school, involves the formulation of an institutional plan for the continuity of education. And the general objective of this is to establish agreements and consensus within the educational community to guarantee continuity, educational permanency of all students, and the progressive use of the educational installations. And it involves the implementation of actions to comply with the hygiene protocol. And this is revised and approved by the Ministry of Education and the Ministry of Public Health. So far, we have over 4,000 schools that have their plan approved. Next slide, please. Mostly the rural schools. And that's also where the priority is currently, on the rural schools, because we know that virtual education is a lot more difficult in rural settings, and also schools are smaller in rural areas. So there's the priority now to reopen rural schools as soon as possible. So approximately 25% of all schools have non-semi-presential education, and 81% of them are public schools. And there's also a monitoring of COVID-19 cases. UNICEF supported also more than 100 schools for reopening. Next slide, please. On the costing, just quickly, before finalizing, based on the national assessment, there was an investment needed of $163 million to close the WaSH in schools gap, and then an immediate investment of more than 20 million to respond to the COVID-19 needs. Next slide, please. So just to finalize, you can see a video also on some elements in Ecuador, and also the conclusions that the limited WaSH services in schools obviously result in high vulnerability. The leadership of the Ministry of Education was very important and technical to allow technical assistance from the cooperation. And now with the evidence on WaSH, we really have the Ministry of Education on board on the importance of WaSH in schools. Thank you very much.
Great, thank you very much, Konrad. This was great. A very well described example, now coming from the global level in one specific country. Thank you very much. And most of you might have already seen there is a lot of discussion already going on in the chat, many questions, and already answered, most of them by Christy and others. So please make use of that. Please also post your question now to Konrad, or to Bella, of course, and still to Christy. And again, at the end, we will have a look at the questions. We will continue now with 3 more presentations, and those presentations are pre-recorded because of different time zones. And now each of those presentations is focusing on one specific tool. But I think it's important to mention now that, that the implementation of these tools was, of course, a result of a step-by-step process from national policy translated into implementing protocols and monitoring. I will introduce now the 3 speakers, and then we will hear the 3 videos in a row, each of them about 4 minutes or so. First video is from Indonesia, Dr. Haris Iskandar, head of the COVID task force at the Ministry of Education, Culture, Research and Technology in Indonesia. Followed by Dr. Corazon Dumlao, Chief Health Program Officer of the School Health Division at the Department of Education in the Philippines. And then Fred Madrid, WaSH advisor with the GSED Fit for School regional program. Enjoy the videos. We will see each other then in our little summarizing plenary discussion. Yeah, we do not hear yet. We can see, but we do not hear yet. Okay, seems that the technical support is restarting the video.
Inviting me to share on how
very good. Now we have the sound. Thank you very much.
In Indonesia. My name is Haris Iskandar. I am a senior trainer at the Ministry of Education, Culture, Research and Technology. And here is the most important thing in reopening. There are some measures that school must follow, such as a maximum capacity on the 50%, the class size between 5 for early childhood and special ed through 18 students per class for primary school, junior and high school. And also learning activities is limited only 1 or 2 days per week and 1 to 2 hours per meeting. And also restriction for sport and outdoor activities. And canteen remain closed, and the HAB must fully obey the health protocols at all time. School must fulfill and submit the school readiness checklist. It must be approved by parents and local governments. And here's some school readiness checklist as reported by more than 316,000 school, or 59% of our total school in our website. One is the availability of sanitation and hygiene facilities, the toilet, hand washing facilities, and disinfectant. It looks good, yeah. And the second variable is in access to healthcare and required area for mask and also thermogun also looks fine. And the third one in the tracking or monitoring of teachers, administrators, student health condition, seems school have some difficulties in identifying the comorbid and identifying whether access to safe transportation or not, and also whether this member has already traveled to high-risk zone or have contact with positives. And this is an issue that we have to find a solution. The second issue, probably this one. This is the other one. Based on a risk assessment of a task force, most of our schools are located at the low and middle level. It's only 5% of our school located at level 4. However, the reality is so far there are only 40% of our school of education unit offering limited face-to-face instruction in this moment. There's a quick survey. We're asking why, and the reason is not student not willing to come to school. It's not parents not giving approval, but it is actually local governments. So most of local government have not finished visiting our school for verification and validation of the school readiness checklist that the school submitted. Therefore, I recommended one is to accelerate vaccination program for teachers and administrators, and also for students above 12 years old. The second recommendation is local government, actually, education office and health offices, has to accelerate verification and validation for school readiness checklist submitted. The third one is a local transportation office at the district to ensure the availability of safe public transportation mode. The fourth one is the local COVID task force to keep campaigning, educating, and reinforce the health protocol in public, wearing masks, washing hands, keeping distance, restriction for public and private gatherings, and limiting domestic movement. And the fifth one, active role from local government right now is badly needed to ensure the success of limited face-to-face learning activities. That's all. Thank you very much. Bye.
Good day, everyone. I'm pleased to present in this UNC Water and Health Conference, the Philippines Water, Sanitation, and Hygiene in Schools, Massive Open Online Courses or MOOCs. Two 40-hour self-paced MOOCs were developed for WINS. These are the Leading WINS, which is a school-level WINS MOOC designed to help school heads, teachers, and school WINS coordinators to improve the quality of WINS implementation in schools by learning the WINS policy, monitoring the program, and planning for improvements. And the Accelerating WINS, which is a division level or subnational level WINS MOOC to help division personnel organize, understand their division-wide data, and plan for technical assistance and WINS program management to schools. In both courses, the integration of different interactive activities encourages interaction among learners to share their best practices. They also learn from co-learners and motivate each other. The WINS MOOCs journey started with the development of the MOOCs in 2019 through the combined efforts of the Department of Education, GIZ through the Fit for School program, and Simyo Inutech under the WINS Technical Working Group. The two courses were piloted in 2019 to 2020 in 5 selected regions. Then the pandemic happened in early 2020, which prompted closure of schools. Now, in response, a new section was developed to include COVID-19 pandemic response and infection prevention control. This section includes a framework and also considerations for safe reopening of schools from UNESCO and World Health Organization, as well as local guidelines on health standards from the Philippines Department of Education and Department of Health. In 2020, the courses were migrated to the DepEd Learning Management System for professional development. This year, to further the institutionalization of the WINS MOOCs, regional teams were capacitated to manage the ongoing course run. In the impact study conducted among the 4 regions that piloted the 2 courses, the evaluation of data shows that there's an increase in percentage of schools improving WaSH conditions, which was significantly higher in schools that participated in the MOOCs, 12.7% increase, than in schools that did not participate, 6.7% increase. In the current pandemic situation and considering that the Philippines is an archipelagic country with an estimated 46,000 schools, the use of digital training solution facilitates wider reach in conveying uniform messages. The WINS MOOCs are utilized in this context, and we continue to use the MOOCs as the main platform to capacitate our focals and school heads safely. As the pandemic has challenged our learning deliveries, we take pride that the MOOC was a pioneer in using technology to break barriers and be an avenue to create informed WINS focals who will be practicing and advocating the program for the WINS. Thank you, and let's all keep safe and healthy.
Good day, everyone. I'm here to share with you an app that we developed to support schools in calculating the running cost of WaSH implementation. I am Frederick Madrid, a WaSH advisor at GIZ Fit for School program here in Southeast Asia. So the app that we developed is called O&M Calculate the Cost app. This was developed mainly to support school heads in calculating the annual recurring cost of proper operation of WaSH activities and simple maintenance of WaSH facilities in schools. And aside from school heads, the app can also be used by education managers in national or even subnational levels to estimate the budget needed for a cluster or group of schools. The calculation of the app also includes PPR or IPC measures that follows WHO and UNICEF and UNESCO recommendations. So how does someone uses the app? First, users provide basic information like number of students, number of classroom, number of toilets, and number of school days, as these are the parameters that help the app calculate the costs. After that, users will then be asked to provide information on cost of items needed. Like if an item that is listed in the app is not applicable or already available from previous year, users may leave those items blank so that the app would not include them on its calculation. Last point I'd like to mention is that once you have installed the app on your devices, it can work even without internet connection. So after providing the information, the app will automatically calculate the cost and presents it in total annual cost per school and per student. Users can also see the breakdown of the cost by tapping on the drop-down arrows, as you can see in the animation. Aside from costs, the app also shows the required quantity per year, which can serve as a shopping list when doing the procurement of these items. At this point, the results are not saved yet, so users need to save the results either by saving it into your device or by sending it via email as a PDF. Now that we have the calculation result, how does this actually support schools? So with the information on cost and quantity, this can help schools to come up with a more appropriate budget for WINS implementation. And aside from that, schools can also make use of the results to mobilize resources from different school stakeholders, because having a clear information on what is needed, on the other side of it, stakeholders would also
Okay, seems that we have a connection problem here. With
also be helpful in estimating future costs, like for example, due to trend of increased student population, and also future costs due to increase of WaSH facilities in schools, because normally the more facilities the school has, of course, the higher the requirement for the cost for operation and maintenance of these facilities. Now, to wrap up my presentation, the app is now available for download, and you may download it by searching the name of the app, O&M Calculate the Cost, or by scanning the respective QR codes on the left and the center, depending on the OS of your device. So for more information about the app, you may check the fact sheet that we developed on the link below. And also a short video explainer is available for first-time users of the app. Currently, the app is available in 3 languages, English, French, and Indonesian, but we are also open to adapt the app into other languages depending on the demand. If you would like to get in touch with us, you may send an email to the email provided here for any concerns regarding the app or potential collaborations. And thank you for lending me your ears, and have a great week, everyone.
Okay, thank you very much, the technical team, for playing the videos and also for quickly solving smaller technical hiccups. Well, we are almost at the end of today's session, so that's why I ask again the 3 speakers, the 3 live speakers, Bella, Christy, Conrad, to turn on their video for a short summarizing panel. You might have seen there was quite a discussion going on in the chat. I would like to connect with that, and in the order of your presentations to come back to the speakers, and to ask Christy first. Is there anything you from the chat, some questions either still open or some questions you regard as so interesting that you would like to share it with the audience? Or would you rather like to react on what you have heard or what we have heard from the 3 video examples?
Thanks, Eric. I'll just note a couple really great questions from the chat. Victoria brought up the concern that we share at the JMP, that data for our coming up report may be limited for some countries with school closures. It's hard to ask about WaSH services at a school that's not actually open. So we do expect that for some countries we might see a data gap, and they won't have updated data for next year's report. But from other countries, we're hoping to see examples of the COVID response that includes WaSH that we can highlight, such as the example from Ecuador, which is just so inspiring and incredible how fast that happened. And to see that kind of information or evidence-based response is just so cool. So we're hoping to find more of those and highlight that. And then Emily brought up a really great point that, you know, you're seeing behaviors and services maybe improve for the pandemic, but then what happens after that? Are we going to see things drop back down? Long-term behavior change is so tricky. So I actually left a question in the chat box to see if other participants have examples of how to retain good hygiene practices at schools after COVID. London School, Robert Driebelvis's group has some great research on nudges that I just think is really cool. But if people have other examples, or if anyone that works on nudges wants to share more details in the chat or open their mic, that would be wonderful. But thank you to all the speakers, including on the videos, for the excellent examples of taking this challenging situation and turning it into a way to address something that's been a critical gap. WaSH in schools is so important. So it's great to see that.
Okay, thank you very much, Christy, for this quick reaction and also comments on the questions what you have seen in the chat. And as you say, everybody's invited to still post and contribute to the discussion there. Due to very little time remaining, we cannot open the microphones, but please be invited to contribute to the chat. I would like to continue with you, Konrad, either also to react on something you have seen in the chat, or maybe to the other presentations. Maybe also the comparison with the Philippines would be maybe interesting when you see possible similarities or differences between the MOOCs. But yeah, what is it? What is the main highlight for you heard in the last hour?
Yeah, thank you, Eric, and maybe just answering a few questions on how the national assessment was done so quickly in Ecuador. Yeah, first it was a joint coordination between the Direction of Education, Information and Statistics from the Ministry of Education, together with the Direction of Risk Management. And obviously the authorities there were very much empowered of the initiatives and really willing to push it forward. And then a second important element was the fact of, let's say, the power of deconcentration of the Ministry of Education, because maybe if we are working in the WaSH sector, which is often decentralized, we don't find this so often, but as the Ministry of Education has deconcentrated, they really, an instruction going from above can reach every school quite quickly, and the follow-up day per day of the filling out of the questionnaire, and also the tool, which was the Kobo toolbox, which was very, very user-friendly, helped a lot also to have quicker responses. So this follow-up and pressure, let's say, to complete the questionnaire as quick as possible really went from the national level to each school level, and this helped a lot. So that was important. And then also on the comment left by Dr. Navarre from India, also the momentum, right, on WaSH in schools. I have to say, before I worked also before the pandemic with the Ministry of Education, it was a lot more difficult to be able to transmit the message of the importance of WaSH in schools for the education sector. Now with the pandemic, we have this momentum on our side to stress the importance and to show everything that has to be done, also the investment needed, and therefore the tool shared by by Frederick is very useful to really quantify the investment needed at each school to assure the services. So that's very useful. And then just a quick comment on the MOOC from Philippines, which I found very interesting to see how this impact evaluation was also done, to see how the course effectively managed to change conditions of WaSH in school at school level, right? So that's very interesting to take with us and see how we can also work with our data on the WaSH in school course completed by teachers to have some idea of the impact as well on the WaSH conditions in those schools. So very useful, these examples, and I think we can learn from every country and every initiatives and try to keep the momentum high for WaSH in schools worldwide, because it's so important, and I think we have made great progress globally. Thanks to the pandemic, but there are still some important gaps to fill. So thank you.
8 minutes left.
Thank you very much, Konrad. Yeah, Bella, back to you. May I ask also you for your main impression of what questions were raised in the chat, examples presented by the colleagues. What you would like to share with us at the end of this session?
Yeah, first, thanks to everyone for these very, very interesting presentations, and also the inputs with the videos. I think very interesting. So we have the whole circle presented coming from Konrad, and then we had certain very specific inputs from specific countries showing how they address the challenge. I think for me, I think very interesting the point was which was made in the first presentation, saying even the Ministry of Education reacted immediately. And for example, in Indonesia, they had very fast, they had the school readiness assessment, they got the results from schools, and they noticed that they have basically now 90% of schools can open, but they say the reality is only 40% of schools do so. So it seems the ministries of education are pretty fast. The local governments take longer. So to assess again, because this sort of collaboration is not totally established. I think that's something which is also an interesting observation. And I also think even we have also to see it looks all very perfect in Ecuador, what's running, and how you were immediately ready to have the MOOC and have assessments in school and so on. But also the situation is still, as you say, only 25% of schools are open, which means 75% are still closed. So that's also the reality we have to see. And I think what I find interesting is how can we, and the question for me, big question is how can we all together support that there's more confidence in opening schools. So very often, I think also local governments, they don't feel confident enough, or school heads have the possibility, say, no, we better don't send our kids to school. That is so dangerous. And I think that is something what needs to be done. So the WaSH situation needs to be improved, and a lot of things have to be done to increase the confidence of all stakeholders to feel safe enough to really open the schools. And that needs also that pandemic preparedness and response measures are taken seriously, and also keep WaSH even after the pandemic, because this is also a point. The school is one of the most important points to prevent infections. And of course, also COVID is an infection. It has developed to a pandemic, and very clear this, we need to have hygiene as important part, and specifically in school. So it's very important not to drop that. And therefore I like this point Christy made, and others also say, what can we do? Have that in mind, that we need to be careful not to drop these, the attention. Yes. That's something I think very important. Perhaps one of the others still want to, Christy or Konrad, perhaps you have other points to add to that. But I think
5 minutes left.
Yeah, Christy, Konrad, anything to add to Bella's comments on different aspects and elements of what we heard?
That was excellent. I think Bella summed it up perfectly, as always. There is another comment in the chat box from Megan with an example of trying to maintain this, hygiene behavior change and kind of create long-term change, building on the momentum from COVID that Conrad mentioned. So she brought up the importance of operation and maintenance, that's going to be such an important element of this. So I just wanted to highlight that so people can see Megan's comment.
Okay, thank you very much, Christy. Well, looking at the time,
Just one point.
Yeah, Bella, please.
Yeah, I would like one point to add too, because I think that's very important. I think also the discussion is important. Please, to all participants, please, if you are interested to receive further information, please place your email address in the chat box so that we could get back to you, and that there is also possibility to connect afterwards and let you know or send more information if ever you are. If you have interested examples to present for other sessions, we're very interested to know about it, to absorb that, to bring, as we said in the beginning, exchange is not just among the people here on the panel, but also among all the participants. And I'm very sure there will be many people with a lot of experience in the audience. Please contribute to the global knowledge. Please help to exchange. Please help support your partners in submitting the data, what Christy said. So also very important, within October, support your government partners to bring the data and so on. So this is also important because that is needed in order to bring the message further forward, raise the alarm clocks, and let's help to get the mission Recovery 2021 realized, as well as not only during pandemic, make WaSH in schools as integral part of education. So that is so important.
Okay, thank you very much, Bella. Also, Christy and Conrad, for your wrap up. Bella, this sounded almost like the formal closing words, but is there any message left you would like to bring at the very end of this session now?
Yeah, again, thanking everyone for this, engaging everyone to join or look at the website of the WINS network. It's pretty new, but please, it will grow, and it will only grow with active involvement of many, many players. So please feel invited, join, and exchange of experience is what we need here, because only exchange of experience and sharing and so on will help to take the shortcut, because otherwise we'll all take far too long and we don't need to reinvent the wheel in many places of the world. So thanks a lot. And yeah, and thank you also, Herwig, for the excellent presentation, and thanks a lot of people in the background who made this session possible. Specifically, I would like to thank Lucy Leclerc, who has been instrumental to get this session moving and organizing it. So Lucy, thanks a lot for all the management of this session. It was just fantastic.
Great, thank you very much, Bella. This was now the formal closure of the event. Many thanks to the German Corporation, GSZ, the WINS Network, for sponsoring this event. Again, thank you very much to speakers, and many thanks to all of you for attending. Yeah, stay safe, stay healthy, and have a good afternoon, have a good evening, or have a good night wherever you are. Thank you very much. Bye-bye.